Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey, listeners, it's Lindsay Smith-Rogers, producer of Public Health on Call. Today, the public health workforce. This sector is facing high turnover, big objectives, and shrinking budgets, and an increasingly hostile environment where rhetoric has turned violent in some cases. Beth, Resnick, and Kirk Sell returned to the podcast to talk about what the data is showing about the current climate, the Bloomberg School's Flag It system, which connects researchers with public safety experts who can help them deal with harassment and threats, and how we can all support each other in this moment. Let's listen. Beth Resnick and Kirk Sell, we're so happy to have both of you back on Public Health on Call. Today, we're talking about the safety and security of the public health workforce, and this is a really multifaceted conversation. I want to first start off by asking both of you about your backgrounds in this work. So, Beth, let's start with you.
Yeah, great. Thank you, Lindsay. Wonderful to be here with you today. So my connection to this, particularly during COVID, I did a lot of research around harassment of public health officials that clearly spiked during COVID, where we had over 1,500 incidents, even within the first few months of COVID. But I wanted to also just put it in the context of my larger research, which is around the public health workforce overall. And do they have enough infrastructure, support, and protection? Because clearly, if you're overstretched and you don't have enough people or you don't have the capacity to do the job, that adds additional stress and burden on these workers. And I've been looking at that for many years, including budget cutbacks during the Great Recession, and we had so many losses of jobs. And then during COVID, everything got really out of control. But the concept of public health workers needing to be supported and protected is a key part of what we need to think about with the public health infrastructure.
And Tara, would you tell us about your work?
Yeah, happy to. Thanks, Lindsay, for having me on the call. So my work really comes more from thinking about public health researchers like myself who've been seeing an increasing amount of harassment related to our public-facing work. And a lot of this has come from, since the pandemic, where public health became more front and center in people's lives and had more of an impact on what people could do. And I can't really relay how vulgar the messages that we get are, because you can word expressions and threats that you can't really say on air, but it's pretty intense. And it hasn't really even let up that much since the pandemic has ended. That politicization has really stayed around. And I hear that a lot in the work that I'm doing on trust and public health rumors as well. A lot of people really hold a more antagonistic view of public health. And while the scientific community itself is really founded on debate, we're seeing some of that disagreement being really expressed in some inappropriate ways, I think.
And would you frame where things are right now in 2025 as we're talking?
Yeah, so in 2025, I really think that there's this growing feeling that the vitriol that people are expressing and often spreading is not really just an expression of their angst and sometimes hatred, but we're seeing people pick up weapons and committing violence with attacks on public servants, including the attack on CDC campus in August. And I think we have to be really careful not to normalize this as part of what's acceptable and what we can expect as part of public service or research or really anything. But we are seeing that this is a growing problem and something I think we need to address.
And Beth?
Yeah, I appreciate, Tara, what you just said. I think it's particularly important when you think about the public health workforce. The majority of the public health workforce is there because they're very mission driven, right? And they want to help people. So now you're an expert on whatever topic it is, but say vaccines or something that's polarizing, right? And now you're being vilified for your views and trying to share information. So I think that that's particularly difficult for public health workers. And it's counter to the image of why they went into public health. So I think that that's also another layer here that is important to consider.
And not just, the rhetoric around it, but to Tara's point, people are actually acting out acts of violence. Tell us a little bit, Beth, from your research about what the data is telling us about what's happening with this sector.
So I think it's important to put this in larger context. When some of the survey data that we have about the larger stress and burnout that was since COVID and around that, which doesn't even include this more recent information that shows nearly 50% of the public health workforce, this data is from state and local health departments, feel like they are under stress, have symptoms of PTSD on an ongoing basis. So it's already been an issue to start, and now you have additional safety concerns on top of that. So it's a really, really large concern about burnout and stress and people leaving their jobs. So again, it's concerning both for the workers' health, but also for the safety of the whole country if we don't have an adequate public health system in place.
Yeah, I was going to ask you, like, from your perspective, what does this high turnover mean for the whole field?
Well, so then you have a couple challenges, right? So as we all know, and wherever we're working, right, if you have somebody who's been there for a long time and they leave, it takes a long time to get a new person back in. You have vacancies. So again, that increases the burden on the existing workforce. You also have the issue of, especially in tight budget times, if someone leaves, oftentimes you don't get the opportunity to refill the position. So that's also a huge challenge. Then, of course, the familiarity with the work and the training. And there is data now that younger people are also churning more across all different organizations, not just public health. So this retention issue is a continual issue across any type of employment, and thinking about how can you assure that your workers want to stay in their positions.
Now, Tara, you have done some work on some solutions. Would you talk a little bit about those?
I think that it's a tough time in public health, but I think this is also a moment where our public health institutions can really show that institutional support, where we can have moments where people say, I've got your back. I think that goes such a long way. The one thing that we've done actually at the school is create this report and response system where we wanted to make something. Beth and I actually worked together on this to really support members of the Bloomberg schools community, where we want to, if they receive a concerning message in response to their public facing work, here's an action that can be taken to really allow them to report the messages via an automated email system that comes to us and allows us to reach back out to them and our security folks to evaluate and review those messages to see if there's, something that needs to be acted upon. We have some great security and our public safety folks at Hopkins who really take this on and take it very seriously. In one case, he reached out to the person who was harassing me and got them to stop. And I think it's just really a moment where you can say, with the follow-up that they do, the outreach that Beth and I do, hopefully this is something that when people get these messages, they don't have to deal with it themselves. And that's, I'm an expert in some sort of public health topic. I don't know how to deal with these moments that are more of a security or that sort of business. And so we have other experts who can come in and help out people. So it's just not on their plate anymore. And, we don't need more stress and more burnout opportunities to come to folks who are already doing quite a bit.
And with this system, my understanding is that there's also like a little bit of training for you, for example, as the recipient of this message as to whether or not or how to engage. Is that part of the process as well?
Yeah, so generally the advice is to not engage, but in the rare case it would be useful. Then we have comms people who can help, but generally it's just to make it so that it really isn't a problem where someone has to deal with it alone, that almost they don't have to feel shamed about it. It's not their fault that someone's sending them horrible things. And so it can make it so that it offloads the burden onto someone who's an expert at dealing with and certainly, is good at it.
And so what else is important to keep in mind about this moment? We've got a number of things going on here. We have increasingly violent rhetoric that is now translating into real-world violence. We've got an overstretched workforce with an enormous burden and mission placed upon them. Beth, do you want to talk a little bit about how we can come together in this moment?
Yeah, it's true. It is scary times. But I also think when you're in these moments, as Tara was saying, it's a very important teachable moment time, right? Like people are vulnerable and they're scared. So it's also the time where if you can make people feel like you hear them and see them and you care about them, it makes a huge difference. So for example, the system that we have set up that Tara was mentioning, Tara and I are monitoring that along with the investigator. And we immediately send back a response to the person saying, thank you so much for reporting. how are you doing? Are you okay? And that just makes such a huge difference. We have had people say, wow, I had something happen before. I didn't know where to go. I didn't know what to do. And I felt like I was all alone. So I think just these small things to make people feel heard and that you care about them. And like you said, have your back. I mean, if you go to the Maslow hierarchy of needs, right? So the second level, the first one is the physiological needs, like, right? Are you fed? Do you have sleep? Things that you need. But the second one is safety, security, and stability. So I think that thinking through who we are, right? And we are all here doing public health. So what do they say oftentimes? Like the shoemakers, kids have no shoes, right? So I think we have to think about our own workforce as part of our community that we are serving. And I've been doing work on mental health and well-being. And again, acknowledging, like after the CDC shooting, I was on a meeting within the next few days where there were CDC people and everyone's just talking about our program objectives. And finally I stopped and I said, hey, hold on a minute. I wanted to say thank you all. And are you okay? We really appreciate you being here and your public service. And the amount of appreciation was just unbelievable. So my point is just these small things can make a big difference. So that's forget about the policies, forget about all of that, but just caring about people. And I know we can't only do that. Of course, we have to think larger, but just on our own individual levels as a start. And then the other thing I just wanted to highlight with the system that Tara and I were working on, Flag It is what we call it, is having that relationship with that public safety investigator has been really big because it opens up your eyes about how law enforcement works in a good way in terms of trying to protect us. So that would be another piece that I would push is that people make these partnerships in advance. You don't wait till something happens and you start working collectively. They understand you, you understand them, and you can work together to think about it. So an example that seems minor, but I think could be a huge difference for somebody is the investigator has the ability to divert messages. So if you have the same person sending you harassing messages, they can divert it so that it's still coming to the investigator so they can be tracking and monitoring it. But the worker themselves or the researcher in our school's case doesn't have to be getting that nasty stuff every week or however often they're sending it. So small little things like that can actually make a big difference.
Yes, and I've actually been on the receiving end of one of those emails, and I put it into Flag It, and I got a response back who said, oh yeah, we know about this person. They've been emailing everybody. And it made me feel so much better knowing that someone was out there recognizing that this was a pattern and just that reassurance of like, yep, got it. We're on it. Don't worry about it. I can tell you it made a big difference for me. Tara, you've been out there talking to a lot of different public health professionals lately. Where do you want to leave us about this moment and what's important to keep in mind?
Well, I want to leave it with we are doing good work and that's why we got into this. And there are tough moments, but I just got off a call where we were doing a large scale training with folks in a different state. And the excitement and passion that I felt from the folks that I was talking to on the call is just something that reminds me why we're doing the work that we're doing, how important it is. We're surrounded by community members who feel the same way. And even though sometimes we're on these Zoom calls and we don't really get to talk about the things that we're passionate about together as much, I think, when we do have a moment to say those types of things, it is something to be excited about. We are still making a difference. And I really want to thank those public health practitioners who are out there on the front lines doing it. Researchers like myself are helping to support, but those folks who are on the front lines really want to say a big thank you. We're all passionate about this together, making a difference in the world and building healthier communities.
And thank you to both of you to all the work that you've been doing. This is an important conversation, and we really appreciate being able to make space to have it and acknowledging that it's a hard time. Good to see you both. Thank you so much.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharpstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.